To get the latest, let's cross now live to Rome to our correspondent there, Seema Gupta. Seema, a worrying increase in the numbers in Italy, but tell us, are people sticking to the current quarantine measures been put in place?
I think for the most part, they appear to be following the rules and measures simply out of concern, deep concern and fear about the spread of COVID-19 here in Italy. If you look at the streets here in Rome, they've shut down St. Peter's Square and the Basilica, as well as Trevi Fountain. And tourists have been told to go back to their hotels, the smattering of tourists that were out on day one of lockdown. Today, we're going into day two, and we understand from opinion polls that some 89% of Italians agree with these draconian measures, and they're not averse either to the idea of making them tougher. Now, up north in Lombardy, in that main cluster where we've seen the bulk of the infections, officials there are calling for more stringent measures. They say shops should be shut as well as public transport. And the only things that should be left open are the essentials, pharmacies, and for people to get access to food. Now, the government hasn't excluded any measure, so we'll have to see what happens in the coming days and weeks. But Italians are buckling down. They know this is necessary in order to contain the spread of disease so that they can protect the most fragile members of the society.
Indeed, Seema, that is the main concern for countries now, is making sure they have the resources available to give the proper care to those who need. What's the situation like currently in Italy? We have been reading that a lot of hospitals, notably in the north, simply don't have the hospital beds that they require.
Yes, indeed. I mean, we're hearing dramatic accounts of healthcare professionals, doctors and nurses working to the point of exhaustion, frustrated that they don't have enough of the ICU, the intensive care units. They don't have enough respirators in order to deal with the cases that are coming in. That they have to make a decision between who gets to live and who doesn't. And so there has been a plea. The government has already ordered hundreds more respirators, as well as hundreds of thousands of more masks. And the foreign minister, Luigi Di Maio, has already been in conversation with his counterpart in China. And we understand that they are going to make a deal in which China is going to provide Italy with over 2 million masks, as well as 10,000 pulmonary ventilators. So clearly some kind of working together on that. There's even talk of the Chinese doctors coming here to Italy to share some of their experiences, because they've been at the front line in the situation in China. Perhaps one silver lining in all of this is that patient number one, that's the so-called super spreader up north. We understand that he is now off a ventilator and is breathing on his own. So that's a silver lining, though, in the situation right now. But the healthcare professionals in the front line, many Italians expressing their solidarity and support for them.
OK, Seema, thanks a lot for bringing us that update. Seema Gupta there, coming to us live there from Rome and bringing us the latest on the current situation with that new virus in Italy.